the families that we serve. So thank you, everyone. We appreciate your time greatly.
Awesome. Thank you so much. So to very briefly bring everybody up to speed on what this Head Start Health Advisory Board is all about. All Head Start programs across the country are required to have a health advisory board. Some go by the name of Health Services Advisory Committee. We call ours a Health Advisory Board. Same. It's the same exact project within the Head Start program to ensure that our program is doing its best to meet the health, nutrition, safety, and mental health and disability needs of children who are enrolled. We are seeking feedback from our partners in the community. So we are required to have an annual meeting as a health advisory board to update the community on what we've been doing as a Head Start program across these different content areas, and to seek formal feedback from professionals in the field in regards to decisions that we might need to make for the following school year. So you will hear very specific questions, especially towards the end, that will require some discussion and special thought from pediatrics, from nutritionists, and then general input from community members, so that we make sure that we're keeping all of those things in mind as we make decisions moving forward. It's in the best interest of the 539 children that we serve across Hays and Caldwell counties. But in addition to that, it is often an opportunity for us to look at the services that are provided to all low-income young children and their families, and really streamline services and have ongoing discussions about how to best meet their needs. Because as a Head Start program that's been in continuous operation since 1965, we've done a lot of work with low-income children and families. There's always more to learn in our field, but we have quite a lot of expertise in what we do here. And I think there's an opportunity for us to all learn from each other as well. So with that being said, we're clocking in great, y'all. We haven't even taken 10 minutes for the first few agenda items, so we're doing great. I'm going to pass it off to Belinda. She's going to introduce herself, and I'm going to pull up her presentation, and then we'll move into nutrition, safety, mental health and disabilities, and then wrap it up with questions and discussion. If you have questions for Belinda in the meantime, kind of as she's presenting, you can feel free to put them in the chat, and I'll kind of monitor that and get those questions answered by Belinda. All right.
All right. Thank you all very much. Again, thank you very much, Alex, for taking your time and assisting us in being part of this Health Advisory Committee. I want to go ahead and just introduce myself. My name is Belinda Pisania. I have been with the agency for 4 years, 2 years with Head Start. Pretty much my role within the agency is to provide families with health information. We have centers all over the Hays and Caldwell County. Next slide, Ms. Alex. So y'all can have a visual of where exactly we are located. We are in San Marcos, in Kyle, and we're also in the Lockhart and Luling Center. We have a total right now enrolled for early Head Start, 125 children. We also have 283 children for Head Start. Next slide. So overall, what I'm going to share with you all is our Head Start standards and what are the requirements as children come into our center initially. So as part of the program, we are required to establish within 30 days that the children have ongoing source of health and dental homes where they are being seen and are receiving services continuously. We are also responsible to making sure that they have that health insurance coverage. That could be either through Medicaid, through CHIP. There's also a program called Title 10, where they are based on a pay scale. We also do contracts with local agencies, health clinics, like Live Oak. And we do also have one with Dr. Martinez to be able to provide services to our children that are not able to get coverage for insurance and to receive those services at a reduced rate where our agency actually pays for the services. Next slide. So part of our requirements as well is for us to go ahead and meet the 45-day requirements to obtain a vision and hearing screenings for children from 0 to 4. This is, I went ahead and provided you all with a vision spot screening machine visual so you guys could see what exactly we're looking at. And I will have some questions for our doctors to show, see this information and to give me feedback to see if this information is sufficient for us to provide a referral back to their pediatric so we can get a referral over to an optometrist or a hearing screening. So this needs to be attained with 45 days. One of the biggest challenges that I have gone through this year has been that children have been virtual with the whole COVID situation. This is something that is we also get assistance from the Lions Club to do those vision screenings done within those 45 days. I'm also required to identify any health needs that the children might have for chronic conditions, such as asthma, diabetes, any kind of allergies. And that is where we reach out back to the FAs will reach out to the pediatrics to request documentation in order for us to have a health plan. That would be in the event that the medication is needed at the centers. Next slide. Within 90 calendar days after the child has entered into the program, we must obtain a document from the pediatrics that they are following the EPSDT schedule. I had added some links on here. We follow the Texas Health Steps. Ms. Alex, if you can go ahead and pull that up. Excuse me. So this is the requirement that's required by the Office of Head Start, that all these screenings are being done in a timely manner for all our children. One of my biggest challenges that I have come across is getting results for lead and hemoglobin that should be administered at the age of 12 months and 24 months. So that is going to be another question that I'm going to need to follow up with to make sure, to come up with a plan to be able to get that documentation from the providers. Next, I would like for you to show the 12 months. So this is a form that's generated by the state. And if you move up, so if this is a form that family advocates share with the pediatrics to request this information. So all that information that is in this form is what I need to be able to enter it into the system, to be able to meet the requirements for Office of Head Start. So if you scroll down towards the bottom part in this 12-month checkup, it's asking there for the lab work that we're needing, that blood test. And then there's also the vision and hearing, the subjective that is being done by the doctors. So if that information is captured in this form, I am able to go ahead and meet that requirement. So that is something that I need to work through with the pediatrics to be able to provide that information for me. I also added on just the 3-year physical form. Again, just an overall of what screenings need to be done at that time when that child goes in to go get that testing done. And those immunization shots, of course, that are very important. This is the immunization shot that is required by the state of Texas. In here, I don't have the influenza shot being listed. However, the CDC immunization, if you can hit the next tab that you have right there, there we go. On this immunization, I was recently informed now that we are required to recommend, give information to our families to have their children vaccinated for the influenza, starting at the age of 6 months, and then thereafter yearly. So I do have some information, next slide, regarding the flu that I got off of the CDC. This is the information that I'm wanting to get kind of approval to see if this is sufficient information to provide the families in order for them to make a determination. I'm not quite sure what information is given at the doctor's office, but this is pretty much where if they still decide to go ahead and refuse the flu shot, then at that point, we will go ahead and have our family advocates have the family sign a refusal of that flu shot. So that's information that I would need somebody, one of the pediatrics to follow up with, Alex. So, and that led me right back into this information that I was just sharing with you guys. So a little bit about the COVID-19 and preparations that we've done. Currently, we are providing and requiring our employees to wear face masks, to wear gloves. We have provided them with smocks, hand sanitizer, which was something that was previously not authorized because of the safety of the children. So I just wanted to share that information with you guys. Next slide. Along with following the guidelines for CDC and childcare licensing, such as anybody that comes into our center, children, staff are required to have temperatures, hand washing, of course, making sure that it's being done before and after eating food, after caring for someone who's sick, vomiting or diarrhea, making sure that after using the toilet that they're also washing their hands. The kiddos, we are only allowing limited visitors into our center. Next slide. So pretty much this is a best practice, new practice. We're just minimizing that contact, keeping those 6 feet distance when children are being dropped off at our centers. We are making sure that if there is a concern regarding fever, that the child is or staff is sent home, along with making sure that they're washing their hands. Next slide. Some of the guidance that Community Action has implemented, of course, is making sure that we monitor any concerns of our staff or children, making sure that they are self-quarantined for the 10 days. If they don't have any concerns or any fever, then they're able to come back. We pretty much make sure that we document and we notify our health department and notify families as needed. Next slide. And this is another part of that positive test results. We need to make sure that before staff come into our center, they are 72 hours fever-free without using any medication before they're cleared to come back into our centers. Currently at this point, next slide, Alex, we have since December, 10 staff within the Office of Head Start. So there's different departments within our agency and 6 children that I have documented as positive. We have quarantine, we have followed the procedures that we need, and we have in place to be able to disinfect and clean. And at this point, that is all I have for y'all. Any questions?
I have a question. You mentioned the hemoglobin and the lead levels at 1 year and 2 years. I think the new EPSDT doesn't require a hemoglobin at 2 years.
Okay.
Does the Head Start still requiring the hemoglobin at 2 years?
So I was going based off of the state requirements. So is that something that has changed, Dr. Harrison?
I believe so, just
Okay.
recently.
Okay, then I
As
will
well,
need.
as well as the lead questionnaire recently, you don't have to do that every year. If you've done it at 1.
Yes, and
And
then at 24 months?
Yes, in 24 months.
Okay, I'll go ahead and
Do the
clarify.
questionnaire.
Yeah, it looks like this document has an update of July 1st, 2018. So
Yeah, I
maybe
think there's
a little
another
more.
update just recently.
Okay, I will go ahead and look for the update then. Thank you very much.
Mhm.
I have a question.
Yes, ma'am.
The information you were saying about the flu, so is that going to be for the new kids starting for August, or are we doing that for the children that are enrolled now?
Currently, Norma. The one that we currently, yes.
Okay.
Thank you, Norma.
I think there are some limitations to that, perhaps. I don't know how much flu vaccine. We're still getting state flu vaccine. We still have some. I don't know what the availability is in getting new. And at least our office still has some availability for both private and state flu vaccine, but I don't know what the availability is for continuing this year's flu vaccine for children. There might be some limitation to that. You might want to check with what's available through the health department.
I see Eric's name on the call, but his screen's black. So I'm wondering if he has some feedback for us. Oh, there he is. Hi, Eric.
So we are actually not receiving flu vaccines at all from the state. Nothing has been handed to us. So we're recommending people go out to private providers or to pharmacies, because we're also not really having a lot of physicians that are actually testing for the flu. Our numbers are extremely down this year. At about this time, normally I'd be reporting somewhere around 300 cases a week. And right now I think I'm reporting 5 cases tomorrow. So it's down for multiple reasons. We're doing social distancing, we're wearing masks, but you know, it's not something that we are receiving vaccines from the state for this year.
We've been giving flu vaccine, but it's been almost non-existent in our practice, but we still are giving children flu vaccine. And we have availability in our office, but yeah, it's been non-existent this year.
Mm-hmm. Thank you for that information.
Okay. Let me get our next presentation up and going. I feel like I need some kind of music playing while I take my sweet time finding the next presentation. So next up is going to be nutrition. So as I'm pulling this up, Bethany, if you would like to introduce yourself and your team.
Hello, everyone. My name is Bethany. I'm the program nutritionist for Community Action. I've been with Community Action for 2 years now. I am a registered dietitian and licensed dietitian. I do have help. I have a nutrition specialist. Her name is Katie Delpiez, and she's currently in a kitchen right now. So next slide, please, Alex. So I would like to start off with some standards. These 4 things determine what I do in Community Action. And our policies and procedures. So I have to follow Head Start standards, childcare licensing standards, caring for our children, as well as child and adult care food program, CACFP. So I would like to just highlight some of these standards that I have to follow, such as serving all children who have not received breakfast, a nourishing breakfast when they arrive to our centers, making sure safe drinking water is available throughout the day, having that menu posted in the classroom as well as in the common area. Children who are 2 to 5 years must be served unflavored low-fat milk, making sure that our breakfast cereals and yogurts are within those sugar limitations, and having whole grain rich food at least 1 time per day, etc. So this is just anytime I am looking for answers or want to implement something, write a new policy procedure, I always look at these 4 guidelines to help me out. Next slide, please. All right, so the bulk of my Head Start standard is meeting the needs of our children. And so I do that a couple ways. The first way that I do that is by having a food substitution form completed by our family advocates at enrollment. And this is to gather information to see whether the child has any special diets such as allergies, intolerances, maybe something that they were born with, a disability, etc. We do require supporting medical documentation for all special diets except for religion purposes. And this also includes infants who are not on our baseline iron fortified formula, which is Similac Advanced. So if they need a special infant formula, if they are, they can't have food at a certain age, or the parent is requesting to start baby cereals, baby food before the recommended age, we need documentation for all those special circumstances. Another way we meet the needs of our children is by completing a nutrition screening form. And this is done at the first parent-teacher conference by our teachers. This is just for children 13 months and older. Infants have something called a monthly infant feeding form that those teachers complete on a monthly basis with the parents. This nutrition screening, it gathers information more on like dietary habits and also identifies any nutrition related needs. I also do a menu analysis. So we do follow CACFP meal patterns for infants and for children 1 to 5 years. And so we have a whole book and multiple educational resources to help guide me on making sure I meet CACFP guidelines. The menu also undergoes a regular analysis via Nutritionist Pro. It's a software program that's at Texas State. And I have my Texas State interns analyze the menu frequently when they are here. They compare the nutrient analysis to professional organization recommendations such as the AAP and World Health Organization. Also, I don't have this on the slide, but we also do heights and weights within the first 45 days of enrollment. So right about the time they're getting that hearing and vision done by Belinda, we're also doing their heights and weights, and that's for children 2 years and older. It has been a little bit of a challenge this year because of, going virtual and COVID. So we have been able to pull some of those heights and weights from health documents if we are not able to get their height and weight when they're in the center. Next slide, please, Alex. Oh, so now we're going to be on support services and education. So how I meet that standard is that I have many opportunities to educate parents. The family advocates will invite me to their parent meetings, and I'll educate on something very basic, healthy eating on a budget, reading the nutrition facts label. And so I'll visit the parents there at their monthly meetings. We also have larger projects done, such as for example, Eat Healthy, Stay Active is a 5-year cohort among Head Start programs across the United States. And we gave simple basic nutrition education, such as information on My Plate, eating healthy on a budget. And we gave information and did presentations for both parents and staff back in the fall. And we are also going to follow up with another presentation next month. I'm also have a open door policy. Any parents that have any specific questions, they can email me, call me. They can let their family advocate know, send a director know that they would like to meet with me. I also asked specifically on that nutrition screening form that I talked about in the last slide. One of the questions it states, would you like to meet with a program nutritionist, registered dietitian for any concerns? I'm currently building a virtual library of resources with the help of my Texas State interns. And so Anytime I have an intern, they're creating a short, simple PowerPoint with a voiceover, and it's on very specific nutrition related topics. My last intern just did one on the division of responsibility by Ellen Statler. It talks about, she goes over about how parents choose what the child eats, but the child chooses the amount and when they eat. And so it's these very short but detailed nutrition educations that I would like to be having, giving out in the future. For the enrolled pregnant women at PEP, we do receive, they do receive information and assistance with WIC and SNAC services. The family advocate / center director helps them with this. They also are regularly checked on, and they are given handouts for pre and postnatal nutrition information. The nutrition education is also given by the Hays ISD RD, and then myself, and then also my approved dietetic interns will also visit this site and give information, nutrition education on breastfeeding, complementary foods, prenatal information, things like that. Next slide, please. So the menu, obviously the menu is a big part of what I do. We do serve breakfast, lunch, and PM snack daily. Every child who's enrolled in our program gets a free breakfast, lunch, and snack. I have a 4-week cycle menu. It changes about 3 to 4 times a year. I do also have a virtual menu. We were virtual for the first 9 weeks of school. And then we also have children who have stayed virtual, even though we currently have children in the center. The menu, I have to put culturally and developmentally appropriate items on the menu. I use the CDC guidelines for choking hazards and the healthychildren.org website to help me build the menu to make sure I'm not putting anything that's hazardous on the menu. I also seek feedback from kitchen staff, teachers. I will pop into the classroom, do observations to see what children are liking and not liking. And it really is a sweet balance between adding new items and then keeping the local favorites to make sure that they're, eating as many items as possible on the menu. And then if you can click on that new spring menu, I would like to just show that. Okay, so this is the new menu that's going to start after the Lent season. There's a couple of things that help determine how I put together the menu. It is a 4-week cycle, like I mentioned before, but obviously the biggest thing is the food program, right? Because we get reimbursement, and so we have to follow all of their patterns. So you'll see to the left side of the screen, we have breakfast, lunch, and snack, and it breaks it down which food groups we have to offer at that time. So for breakfast, we have to offer a fruit, vegetable, or both, a grain, and then milk. And then for lunch, we have to offer all 5 of those components, and then snack is 2 of those 5. So we do have to meet all of these components, but then we also have to meet a minimum amount for each component. And so that's why you'll see that 1/2 cup, by the diced peaches, 1/2 cup to 3/4 cup by the milk, etc. So the teachers know exactly what they are supposed to be serving, how much to each child. Other things that help determine, besides the CSCP, like I said, the choking hazards, as well as the culturally and developmentally appropriate foods, getting that feedback from kitchen staff and from, other staff members to see, what has been a hit, what hasn't, what kids are really not touching, and what are things that they are loving. Another thing that I have to take into consideration is our storage space. How much room do we have to store? How much freezer, refrigerator, dry pantry area do we have to store all this food, as well as what appliances we have. So we don't have steamers and some other appliances in our kitchens. And so we have to really just think about what appliances we can, what food that can go on the menu that will work with our kitchens, the ability of our cooks, and then just the space. And so if there's not any questions about the menu, we can move on to the next slide. So some general policies and procedures. Like I said in the at the beginning of this presentation, there is many standards that we have to follow, but these are some things that are more community action based. So we do not allow any outside food or drinks in our standalone centers. I don't have anything related to peanuts on the menu just because that is a pretty severe allergy. And so I don't have any food that contain peanuts or peanuts themselves. We do give WIC information, CSCFP complaint procedure information, and as well as that CSCFP participation information. And that's given at enrollment, and then it stays on our community action website. Another general policy is no more than 2 servings of milk at one time, and 1 serving is considered 4 to 6 ounces. And that's just so children are not getting filled up on milk. And so, they're encouraged to try other things on their plate. And so this is just a good way to, cap up the milk drinkers. Children arriving after breakfast between 9 and 10 a.m. will be given a WIC approved cereal with their milk. Then after 10, they're just given a fruit. And that's just because the kitchen is already on their way to making lunch. Fruit, it doesn't keep you full for very long. And so if we give this child a nice nutritious fruit that they're going to be able to digest pretty soon, and then they're going to be ready for a nice meal at lunchtime at 11. Next slide. So these are some changes that we made for COVID. We were virtual for the first 9 weeks of school, and we did have a weekly food pickup. It was a grab and go option. It was every Tuesday was distribution day. And the time to pick up varied by site, but in general, it was between 8 a.m. and 2 p.m. Each enrolled child received 5 breakfasts, 5 lunches, and 5 snacks. Again, all meals and snacks were free. The parents were also giving cooking instructions or really heating instructions. Everything that we prepared was already chopped, already cooked, and ready to go. Essentially, all the parent had to do was warm it up. So these instructions were more like, hey, this is what's on the menu. Please defrost this, move this item from the freezer to the refrigerator, and then this is how you heat it. We did still follow all the CSCFP regulations. I did have to apply for many waivers in order for this grab and go pickup to happen. And we did still follow the required documents and postings that they required. Whenever we are in class, we do not allow family style meals at this time. Teachers are serving the children themselves, and the snacks are individually wrapped as much as possible. Teachers are wearing gloves and masks while the food is being served, and the teacher will wear the mask until they're sitting down at the table with the children. There was some construction changes to some of our kitchens, and that was to decrease the traffic flow into the classrooms and kitchens. And I think that is about it. We still have some virtual children, so across the agencies, so some children are still doing the weekly pickup, even though the bulk of our children are in class at school. And I think that is the end of my presentation.
Does anybody have any immediate questions for Bethany? Okay. So let me get set up with our next presentation. And if anybody wants to just like sing a song while I'm doing it, that's cool. Next up is going to be our safety and operations presentation. Labrika, if you want to introduce yourself while I get your presentation pulled.
Yes, ma'am. Hello, everyone. My name is Labrika Fennell. I'm the Operations and Safety Coordinator for the Head Start program. I have been with Community Action for 4 years and recently transitioned to the coordinator position in June. All right, so on this slide, I'm going to explain the goal for operations. Our goal is to provide a safe environment at all times for children and families and the staff. We also ensure that the facilities are clean, safe, and maintained in a good condition. We conduct ongoing monitoring to make sure that the facilities have adequate space, light, ventilation, heat, and other physical arrangements that are consistent with the health and safety and development needs of the children that are served. Our center-based staff also conduct safety checks to ensure that the classrooms and hallways, the outdoor play space are hazardous free. Any health or safety concerns are reported to the center director, and then the center director then reports the concerns to myself. We also provide children and families with pedestrian safety information and skills. So families and children receive the pedestrian safety training within the first 45 days of enrollment. Teachers also provide safety training monthly in the classrooms. We also work with our parents in their home setting to provide emergency preparedness and safety and home safety. So during the home visits, the teachers will check in with the parents to make sure they have smoke detectors, outlet plug covers, any safety components that are needed for their home. We just check in to see if there are any needs. Next slide, Alex. We have implemented some changes for operations and safety due to COVID. We have social distance markers and COVID signs at facility entrance doors. We're encouraging our staff and children to frequently use hand sanitizer and disinfectant wipes throughout the day. We have also put in covered walkways for parents at drop off and pickup since parents are not able to enter the facilities. During our virtual services, families are able to pick up supplies on distribution days. So from my content, they're able to get diapers and wipes if it is needed. We also have first responder technology and equipment in place for sanitation. And the next couple of slides, I'll kind of go more in depth to explain each equipment that we have in place. We have hired program support staff to also help implement sanitation procedures daily, such as sanitizing the door handles, those commonly touched areas throughout the day at the facilities. Next slide. So this is one of the first responder technology equipment that we use at our sites. It's called the handheld UVC sterilizer. The handheld UV sterilizer utilizes a UV light to eliminate pathogens on any surface in seconds. It's for rapid spot cleaning on any kind of surface. You simply just shine the UV light on the desired area. It takes just a few seconds to sterilize any area that is exposed to the pathogens. And we have one handheld UVC sterilizer per site. Next slide. We also have an electrostatic backpack sprayer that we're using. The electrostatic backpack sprayer is great for floors, walls, desktops, equipments. Pretty much you can use it throughout the office, the classroom, or throughout your building to disinfect. We have our program support staff, our center directors using the backpack sprayer once there has been a positive COVID case being reported. Then they go in and sanitize that area that the person had exposure. We have one backpack sprayer per site. Next slide. We're also using the nest and the sterilizer. So this is 2 compartments. The top picture is the nest. And on that second picture, the black box, that is the sterilizer, the ozone sterilizer. So it is airtight. It allows safe and convenient sterilization of multiple items that can fit inside. We put our classroom equipment in there, also, our board books, pretend play food. You can also put in calculators, masks, glasses, keyboards, anything that can fit can go inside to sterilize. We're also using this equipment at the end of the day once our children leave. And there's only one nest and sterilizer per 2 classrooms. Are there any questions in regards to the safety procedures that we have in place? Okay, well, that's all that I have. Thank you.
Awesome. Thank you, ma'am. And our final presentation, we are rocking and rolling time-wise. Fantastic, y'all. So I think we're going to have lots of time at the end. So next up is our mental health and disabilities coordinator. Patricia, if you want to introduce yourself, and I will get your slide up.
Hello, everyone. I'm Patricia Vargas, and I am the mental health and disabilities coordinator. I've been with Community Action since April. Well, it's going to be a year. It's going to be a year next month. So, and we're going to go over, like everyone else had presented to, that there's different standards that we have to follow. And these are the ones for our, from the Head Start performance standards. We do our child screenings and assessments. The one for our mental health screener is the DECA. Our child mental health and social emotional well-being are at an enrollment. The families are have a it's a survey to assess their mental health and well-being for them and for the child. And then also we have family support services for health, nutrition, and mental health. And that's why we're having this health advisory meeting. We work all together to make sure that we're meeting the needs for our families, both supporting the health, safety, nutrition, and mental health. And then the community partnership and collaboration with early childhood and education programs. And so that's another performance standard that we're building relationships with our community. And so, in our next slide, I'll share some of the relationships that we have been building as well. And then we provide training and professional development, both for mental health and disabilities as well. And then there is also a performance standard that we need to have a staff health and wellness program. And so under disabilities, under enrollment, we have where we determine and verify, and we need the documentation of eligibility and recruitment and selection. So we need documentation of the disability in order for us to, to get points for their application, and that's for the families as well. And then we have teaching and learning environments. Before a child with a disability begins services at our Head Start or Early Head Start, we'll have a meeting with the teachers to make sure that the environment is ready, and also that they're aware of all the disability and what the child's goals are, and what we're going to be working on with that child for that school year. And then here for the child screening and assessment under disability, we have the ASQ. It's what it's a developmental screening that we do to assess the child, and that's done within the first 45 days of enrollment. And then we also have safety practices that we have to follow. And we'll do a safety plan if necessary for any child that's needing a safety plan. And we'll make sure that they're safe and well in our centers. And then again, also under disabilities, we're building those partnerships and collaborating with early childhood and education programs. And under disability, we're making sure that we're establishing a good working relationship with our ECI programs and also with our school districts. And then part F, it's a whole section all about all the additional services for children with disabilities. You know, if a child with a disability is, you know, has a need, we're gonna work with that family and with that center to make sure that they're getting their needs met as well. And then we have the transition services is when a child is moving from early Head Start to Head Start or transitioning from Head Start to the school district. We're making sure that we're working with the family as well to make sure that that transition is smooth. And there are certain requirements as well. Like it's usually 6 months before a child is transitioning from one setting to another setting. We want to make sure that that family is supported in that transition as well. And we do also do professional development and training every school year to ensure that we're meeting the needs of the children with disability. And if there is a new child starting that the teachers are unfamiliar with this certain disability, then I would make sure that we would get them the required training for that child, and making sure that they understand the needs and also how to meet that child's needs as well. You can go to the next slide. And here are some of our successes for this school year, where we have met the 45-day DECA and ASQ assessment requirements. Where we're making sure that the teachers. Well, this year, what we ended up having to do within the 45 days is having the parent do the DECA and ASQ instead of the teacher doing that initial DECA and ASQ in order to meet that requirement, but we were able to meet that requirement. We're still having referrals, to ECI and to the school district, and so that's still happening, and it's ongoing, and that's changed as well due to COVID, and I'll explain on the next slide more about that as well. Then we've partnered with the university, Texas State University, and with the Aspen program, and we've had several families who have enrolled into this program as well, and it's for children who have a concern, and they could be on this the spectrum of autism, or they may just have a speech delay, but they have their own criteria of who qualifies and who doesn't. But we have had several parents who have qualified and are part of that program as well. And then another community partner that we partner with is with the NAU, that's the Texas AEYC recess program. And so, and we, that is mainly in Caldwell and in our Caldwell County that we are partnering with the schools as well. And then we've done the Eating Healthy, Stay Active cohort with UCLA, and that's the National Center of Early Childhood Health and Wellness. So that incorporates both health and nutrition and the mental wellness as well. And so our teachers, and Bethany had already spoke about it too, that our teachers have been part of this, and also our parents, and we're going to do another training to close it out for this school year in April. And then some of our successes for professional development is we were able to do conscious discipline training during when we were not in session. We were able to teach several of our teachers, both the early Head Start and the Head Start, to have conscious discipline training. And then also we've been doing a book study with the Texas Resource Recess program as well with some of our teachers. And then we had our all staff day. That was another success where it was all focused on health and wellness. And so that was a great success as well. And then one of our upcoming trainings, we're going to do a teacher appreciation, and something new that we've are starting is having a teacher of the year, or a teacher assistant of the year as well. And so that's to help the wellness of our teachers as well. And then the staff wellness program, each center has their own wellness program that they started at the beginning of the school year. And so that's something else that has been a success as well. And you can go to the next slide. And now I was going to talk about some of our challenges that we've had versus, virtual versus in person. So I was actually at an ARD before I hopped on. I was a little late, but a lot of the ARD meetings, which is it's an annual review and dismissal for the school district, have been virtual. So so we've been meeting with families virtually with the school district, making sure that they're getting their annual reviews completed in the timely manner as well. So that's been a good thing. It's the other, I guess, challenge would be is sometimes we don't get the documentation. So that was, it's been kind of a challenge, and it depends on the school district too as well. And so, and then also with ECI, that's the early childhood intervention. They're still seeing children virtually. So what they'll do is have their therapists on a Zoom, and so they're seeing the child. So we're having to have either support staff or center director sit in with the child to make sure that they're getting that therapy that that usually the therapist would come to the school and give that child their therapy. So it's been a little challenge, but we are working it, and they are still getting the services that they're needing. So it's just the therapist will give the instruction to the center director or that support staff, and then they'll do the therapy with the child during that session. And so, and then also mental health consultation services have all been virtual as well. There's not very many consultants that will meet in person. And so I'm hoping that in the near future that we'll be able to be meeting that need and be meeting in person and getting those services as well. Our 10% funded enrollment for children with disabilities, that's one of our performance standards that is for serving our funded enrollment for 10%. It has increased since the beginning of the school year, but we're still not at that 10%, and a lot of it can be due to the COVID. Is like a lot of our children are not getting the in-person services, so they're choosing to either unenroll their child and be at home, and then do the services virtually versus versus staying in school. And so being in school and then virtual, and then in school and in virtual, that's also been a challenge as to meeting the needs of the children as well, because we're seeing that they're starting all over. Once they left, and now they're coming back again, and they're starting all over again. So that's kind of been a challenge for our teachers, going back and forth. But they are doing it, and they're doing a very good job. And I know it is a challenge for them that they had as well. And then our staff wellness program is, keeping it going. That seems to be a challenge at some of our centers, is and making sure that they take time to take care of themselves. And so we're working on trying to help them to keep it going as well. But that's all that I had for y'all. If y'all have any questions about any of the items that I had brought up, so you can ask away. There's a comment.
Okay, so we have come to the time in our meeting where we are going to dive into some of our questions. Belinda sent me a list of some questions that we want to get feedback from y'all about. Belinda, do you want to?
I can ask them.
Yeah, and
because I know that some of them were answered with Dr. Harrison. So, but I would like the opportunity to ask.
Yeah, I'm gonna mute myself and I'm gonna take notes while there's discussion. Okay.
All right. Thanks, Alex. So, Dr. Harrison, she's still with us, right? Great. So, one of the questions, Dr. Harrison, that I have come across is us providing, in the past, we would provide products to our families to treat lice. When I came in, that was put to a stop. I need to get some guidance. Currently, what we do is we provide them with combs and an educational pamphlet, how to clean, disinfect, treat other family members that are experiencing lice. I know families that have Medicaid do, and if they go to the doctor, they are provided with medication. However, several of my centers have requested the shampoo, and that was a question that I kind of needed some kind of guidance, if this is something that you all would recommend.
And to be honest with you, most of the over-the-counter medications, the lice around here are resistant to. I think the prescription things work well. You might as well, honestly, do mayonnaise. It's probably just as effective or more so than the over-the-counter medications. And our biggest concern is you're using a pesticide on these kids' head, and they overuse it trying to get rid of it, and it's not effective anyway. So if you can get some really greasy mayonnaise, the high fat stuff, and get them to use it overnight, put a shower cap over their head, it's probably just about as effective as the over-the-counter stuff, and see if that works. And then if it doesn't, you're pretty much left with getting something prescription.
Okay. Another question regarding the lead and hemoglobin, Dr. Harrison. So you said those are questionnaires that you all are completing at y'all's clinic.
We've pretty much not. I think the new EPSDT that came out says if you do a lead and a hemoglobin at a year, and then you do a lead level at 2, then you don't have to do the questionnaires at all.
Okay, understood.
I believe that's correct.
Okay. I guess, well, so one of my follow-up questions regarding that testing was purchasing that equipment to test our children here at our center, and to see if our WIC representative, how they were addressing that, if they were getting tested. Is our WIC representative on here, Alex?
No, she's actually the one who chatted that she had to run.
Okay,
We can
we'll follow up with that.
either Dr. Harrison, or we can always follow up with Stacy offline too.
Yeah, you could ask my office manager, Michelle Comstock, how much that equipment costs. Yeah, we do in-house lead levels, and then if they're abnormal, we send them to the CPL to do it.
Michelle,
I know WIC does. Yeah, Michelle Comstock.
okay.
I know that I know WIC is doing hemoglobin or either hematocrit levels 1. I don't know that they do lead. I never hear that they've done lead, but I may be wrong in that.
Okay, all right. That's all I have, Alex.
Michelle could also tell you what the latest EPSDT is, because we just recently changed that. We became aware of that.
Okay, understood. Thank you, doctor.
Mm-hmm.
You had some questions about hearing and vision, especially for kiddos on the autism spectrum. Is that something?
Yes.
Because I know like Holly is here from Lockhart ISD and she works with special ed. So that might be something that we could discuss as well.
So as I had briefly shown the equipment, we do use the vision spot machine. And we also use the OAE machine for the hearing. I do have some children who just will not sit still. And I'm trying to find a way to be able to, and I know Ms. Sharman has experienced that as well. At what point should we refer them over to you all? We do the screening for the vision. Initially, I was only doing it once. However, there was a lot of concern of children that weren't passing the vision. So I went ahead and gave them like a week or two, and then I would go back in there and re-screen them as well. And I was getting a different testing, like they were passing at the second for the vision. So that's one of those barriers that I have.
We have a hard time. I mean, testing at that age is so difficult, and we stopped using that. We tried that spot check and we were getting such unreliable results, and we'd send them to the ophthalmologist and they kept saying, quit sending them.
Okay.
We had that same difficulty. It's hard to do that age group.
Thank you for sharing that with me, Dr. Harrison. And because that is one of the things that I put on the FAs, is to make sure that they're following up with the parents and that they are referring them if there is a concern.
The hearing, yeah, when those are, we quit, we didn't buy another piece of OAE equipment. Ours broke and they were so expensive. When they get to be moving around too much, they're not very reliable.
That has been one of my
on hearing. We send them to the ENT and they get a better hearing screen. We can't do it at that age group either. It's just difficult for that age group.
Okay, thank you very much.
Yeah, I agree. When they're that age group, especially if we're suspecting autism, a booth is the better way to go for hearing. Just being in the ENT's office is usually how we end up doing it.
Okay.
But we do screen them for vision and hearing. And so if it's a student that you are going to be referring to the school district, we do a vision and hearing screening as part of our evaluation anyway. So if you're not able to do it and you know you're referring them, we will do that as part of our evaluation.
Okay, thank you. That's all I had, Alex. I don't know if Sharman had any questions regarding the COVID. No? Come on, Sharman.
Well, it's the ones our question does Dr. Harris would be the one to answer. Do you think they're ever going to have a COVID for the children, COVID shot for the children?
I think so. The speculation is that by the school year, they may have it down to 12. By the end of the year, the hope is that it will be down to 6 months. They started doing testing on it this week, in fact, down to 6 months. And they're working on the dosage for that. And the hope is that by the end of the year, it will be available down to 6 months.
That be a requirement then? Like, you know, the DTaP and stuff are like required certain ones.
I think that's going to be up to the state of Texas. If it's going to be a requirement, I would love it to be, but you know, does the state of Texas mandate anything? I don't know.
Okay.
I would certainly like to see that happen.
I can add a little bit to that. It's not going to be a requirement until there's a lot more research that's been performed on any possible side effects any long-term effects that could occur. So it may be down the road, it could be, but right now it's not going to be anything immediate.
I think there was a question that came up about that flu brochure.
Yes, ma'am. So that was me, because CDC has that on their spreadsheet, friendly immunization. So the Office of Head Start informed us that we are to get that either a refusal waiver, which we've just recently added on to our database, where parents are going to be able to sign off that they will not get that flu shot.
I think that's reasonable to do. I think there's already been some confusion with that. We had a patient call and say that that was going to be required, and we called about it because we were confused as well, and clarified that it, you know, they were offering it, but it was not required.
Okay.
So I think that has to be explained to them that it's not required, but that we're encouraging it, or y'all are encouraging it. Just
okay. The way we word it to them.
Right.
What would be the recommendation then for families that don't have health insurance? Maybe undocumented families that don't have access to Medicaid, that would maybe typically go to the health department for something like that. Where should they be going to get?
No, we refer them over to Live Oak.
Okay. And Live Oak does have the shot.
Yes, we will reimburse Live Oak any patients that we refer, whether it be employees or children. And we have an agreement with Dr. Martinez for dental. And I'm working on Lockhart and Luling. Any other questions? Anybody? Concerns?
I have a question. It's about transitioning to the bottle. I mean, transitioning off the bottle, from the bottle to the cup. Do y'all, Dr. Harrison, do y'all have like a conversation about this transition? Is it a standard across the medical field? Or y'all have conversations about when and how to transition off the bottle to a cup?
I think all of us in our office discuss it during our well checkups. In particular, I tell people to start transitioning around 9 months, and at a year I say please try to get them off by 15 months. But then I see them come back here at 2 and 2.5, and they still have the bottle in their mouth. But
yeah, that's one question that I do ask on that nutrition screening. Do they have any dental problems? Or is they still on the bottle? And that nutrition screening is for 13 months and older. Mm-hmm. And so if they select still on the bottle, then that's when I, talk to the FA about educating the parent about, hey, it's time to start transitioning off. At our centers, they're already using a cup. And so
we've actually started doing the Texas Health Steps dental screen in our office, and doing fluoride applications for those kids that are eligible for that.
That's good news. Thank you for sharing that with us.
Is there anybody here from food service? Any ISD food service? Okay.
Okay. If there are no additional questions for anyone on the call, we are getting back a whopping 45 minutes of time, which is pretty great. Does anybody have any announcements or anything that they want to share? Since I made y'all, we saved a lot of time at the beginning by not doing introductions, but if you have anything that you want to share with the group, upcoming events, anything like that, feel free to unmute yourself and kind of share that information, or throw it up in the chat, or do both, just to make sure that the information gets out there. You can put links in the chat to websites or any other relevant information. And then, like I said, once we are completed with the meeting today, I'll send a follow-up email that'll include a lot of things, like all the presentations and the notes and the chat, just for your reference and follow up. And then in about a year from now, we will do this all over again. We'll have another health advisory board meeting.
I will throw something out, since we're talking about nutrition, and this would apply more for older kids. And they do take Medicaid, I believe, in CHIPS as well, private insurance and private pay. HEB is doing nutritional counseling now. And I have referred several patients to them, and they do a really good job. I've had a hard time for kids, the older kids especially, that had obesity problems, getting any nutritional counseling. And they have services to provide that.
I agree, Dr. Harrison. I was able to, during my internship, I was able to rotate with HEB and their dietitians, and they do a really great job.
Yeah.
And I know that's come up in other conversations we've had about the experiences of young children and all children really during COVID. A lot more indoor time, a lot less structured, organized outdoor activities through athletics, etc. And that can, if we keep eating the same amount, but we're exercising less, or we're eating more for comfort, etc., that's kind of a natural, a natural impact for our littles, is that they are going to be a little bit heavier. And so figuring out all the things we can do to educate on nutrition and physical activity. I know a lot of folks have noticed, I think it was you, Dr. Harrison, that was like from visit to visit noticing some of these kiddos just getting heavier and heavier and heavier during COVID very, very rapidly, like more than you would ever expect to see normally. So yeah, I think that's important for all of us. All right.
I have something to throw out if you got a second.
Absolutely.
As of this morning around 10 o'clock or so, just in case everybody hadn't heard, the state of Texas has now decided that any adult that wants a COVID vaccine is now eligible to get a vaccine. It's no longer based on job or age or anything like that. And so here at the Hays County Health Department, if you or your staff or have any other people that have not gotten a vaccine, starting Monday, we will start accepting walk-ups. Don't have to be pre-registered on a list. You can show up here at the health department, 401 Broadway. I believe the doses that we're going to be continuing to give out from the health department will be Pfizer's. We don't seem to be getting any Johnson & Johnson anytime soon. And then the Moderna is getting more and more difficult actually to obtain. We're kind of at the whim of whatever the state gives us, but they are giving us plenty of Pfizer. So I think at least twice a week, we'll be probably doing walk-ups and providing vaccines starting Monday to anybody that shows up.
Does that include 17-year-olds, since Pfizer's approved for 16 on up?
Correct, yes. Pfizer's 16 and up, and it says adults, but they didn't exactly say any age exactly, saying it had to be 18 or older or 21 and older. So it is for whatever the vaccine is approved for.
Is there a certain time?
We open at 8. We close from 12 to 1 during lunchtime, and then open back up at 1, and usually try to cut it off at about 4:30 or so. So we'll be announcing it on all of our social media platforms and stuff as soon as we have it, and as soon as we know exact dates, we'll be doing it. But we're doing a clinic today, actually, and somebody put it on Facebook saying we're giving out free shots to anyone, which is not true. And I've got 200 people outside my window right now who are angry. So.
Oh, goodness.
Eric, I have a question for you, please.
Yes, ma'am.
are there any plans to try to reach those homebound people that can't make it to the clinic?
We are working with that with our firefighters and EMTs. We're working on getting addresses, gathering them to where we'd be able to go out and do mobile clinics of, perhaps 20 to 30 people per day going around. Rather than going and doing just one dose somewhere, we'd like to try if we can go out to an area and hit multiple houses in a city. And so we're working on that plan right now.
We would be more than willing to use our senior citizen center as a hub if you need it, because a lot of our seniors have not gotten their shots yet.
Okay. So our emergency preparedness department is the one that's actually doing all the acquisition of vaccines and setting up our clinics that we've been having in Kyle, San Marcos, everywhere. And so I will reach out to Mike Jones, who's the director, to let him know, because that's something that we have been getting a lot of requests for lately.
Okay. Any other final questions for Eric or Dr. Harrison?
I have a question, and it's
all this information.
My question was about, I've had a couple people say that they've gotten the first dose of the vaccine somewhere, yes, and then they've gone other places to try to get the second dose, and it's not allowed. So I guess, how does that work with?
So the way it was supposed to work is wherever they got the first dose, they were supposed to be automatically registered where they would be getting their second dose at that location 3 weeks later. One of the issues we found, a lot of it was with Austin Public Health. They were trying to do so many massive drive-through clinics that they could not keep up actually with getting all the information inputted into M-Track to where it would automatically order the next dose. And so we're running into that a lot. At the moment, the only option we really have is, like I was saying, if somebody's looking for their second dose of Moderna, I really don't even have a single clinic that I know that is carrying that at the moment. And so when people are looking for a second dose of Pfizer, we kind of put them on a wait list, and to where we have appointments right now scheduled for people to come in and get their doses. But at the end of the day, we start running into people who didn't show up, or they started their doses somewhere else, so they didn't need to be registered on the list. And so we just start making phone calls saying, can you get here in an hour? We've got a needle with your name on it. So that's kind of the only option at the moment, unfortunately.
All right, y'all. It's minutes to 1 o'clock. So I think we'll go ahead and wrap up the meeting here. If there are any emails or anything that if people want to connect via email and you don't have contact information, just shoot me an email. I have everybody's addresses from either sign in or just in general. And I can get y'all connected offline. Have a wonderful day. Thank you so much for joining us. When we do this again next year, I'll buy y'all lunch. How about that? It'll be so much more fun to do it in person.
Exactly.
Thank you.
Thank you all very much.
Bye.
Yes,
Thank you.
appreciate it.
Bye. Bye.